Welcome to another episode of Public Health Perspectives. Hi, it's Bynum. Thank you for joining the show today.
Thanks for having me. Appreciate it.
Would you mind giving me a little bit about your background?
Okay, so, my background in education, my background is in health science. So I graduated with my bachelor's of science degree in health education with a emphasis in community health and Spanish. And so after that, I really needed a professional job because before that I was working as a cashier in retail, which was Kroger. So, using my customer service background, I was able to land my first opportunity and work at the state health department. And so my first role there was a secretary, and I used that role to get my foot in the door because everybody was saying as I was applying for jobs, I had a degree, but I didn't have any experience. That's where I found myself, Camilla. I was trying my best just to figure out what was working and what skills were highly valuable at the health department. And so luckily, I landed a position in health statistics. And so with my background being in health education and working in health statistics, I was wondering, like, how's this going to fit? And so I figured it out one day. I was like, well, the epidemiologists and the statisticians, they have their own language, right? And so my niche and my role was to help break down what they were saying into simple terms. And so people would call for data requests, like requests for information from one of the databases, whether it be like death, birth, or one of the surveys. And they would receive the call, but they wouldn't understand like what the statistician, what the epidemiologist was saying. And so everybody really started loving me as a secretary because I could break stuff down in the simple terms. And so I stayed there for a year and a half, and they promoted me to the births coordinator position. I'm telling you all this because I think, for the most part, when people think of public health, they want to start off, after they receive their degree, they want to start off in a position that pays well. But
right,
a lot of them, whether you're working in a hotel or working as a cashier at a retail store, all of those skills are transferable. And so, I was using my customer service skills to really help the public to understand what it is that they needed what they need as far as information from the epidemiologist and the statistician. And so this is really translating for them. And so my background was in Spanish. Like, I was like really good at speaking Spanish, but it's like use it or lose it. And so I didn't have a conversational partner. So I eventually just I flip-flopped and lost that skill set. But when I started, they were like, oh, okay, Latonya, if you can understand Spanish as a language, then you will easily be able to understand SAS. Now, have you heard of SAS?
Yes, ma'am.
Yes. So because I understood Spanish, they felt like I could use those same skills to understand the programming language, and it worked out in my favor. So I learned SAS on the job. So a lot of the students now with the Master's in Public Health, they're actually learning it at school, whereas I learned it on the job. And so I was just looking up information on courses in SAS and how to code and all that. So I basically, I was a self-starter with my health education background, and I just figured it out on my own. I didn't have a mentor or anything. I was just like, you know what, I'm going to go with what's highly valuable around here. And so, I moved from that position, secretary, to the CDC births coordinator. So are you familiar with the Behavioral Risk Factor Surveillance System program?
Yes, ma'am.
Yeah, so, every state has its own births survey. And so I was the coordinator for Arkansas, and I think a lot of students become familiar with BRFAs when they're doing their master's or graduate degree. It's an easy way to do their thesis or project plan just to graduate. And so I just became interested in like, okay, what can I do to advance my career?
And so I know your background, so you gave me information about that. The reason I saw your name and contacted you was because I saw that you led CHES study groups and people were commenting about how great it was. And I'm like, this would have been awesome to have. They had some study group kind of initiatives whenever I took the CHES, but I didn't always take advantage of those. I did the studying on my own. To have somebody to kind of lead you, and like I mentioned, especially for my group, someone who looks like you, lead you in the right direction is so comforting.
I worked at the health department. We had an organization called the Society of Public Health Educators or Education, I believe, Sophie. So, they did a lot of activities as far as getting members to network and kind of know who's who in health education and what kind of careers or jobs are available in each of the settings. And most of the health educators in the organization were working at the health department. So I noticed, one of the things was that there weren't a lot of resources for students. They would come to the meetings, but, they're like, they need resources as far as paying for the exam or study tips or like what books to buy. And they had questions like that. And I always felt like, okay, that's something that Sophie could do a better job of. But I never found anyone to pick up that torch. And so I thought, what better way to help engage the students and help them pass the first time around? Because on the first time that I took it right after graduating, I failed it by 3 points. And so I was really interested in how to serve as like a study buddy and help students stay accountable and pass it on the first time around. So I just came up with like a little course overview. And so far, I've only had 2 people to take my course and actually not pass, but they said they really had one girl had test anxiety, which a lot of students do have. So one of my sessions now included just a little short talk on how to cope with test anxiety. And then another girl says, she didn't study at all. And so what I started doing here recently is including homework sessions. So I'm really working with the students one-on-one to see what it is that they're thinking. Because, it's one thing to study all that stuff in school, but then when you actually take the exam, they want to see how are you applying this to the real world. So I call my sessions Think Like a Health Educator, and I kind of walk them through that process. And so far with the homework, people are doing better. So,
and you know what? That reminds me. I work for the Journal of Public Health Management and Practice. Mm-hmm. We have a companion site. It's kind of like a blog, but we have a bunch of resources on there. So that's where we do student Q&As with researchers who have published in the journal. The podcast, of course, is posted there. And we have a few other series and then some expert categories where we were trying to come up with a way to make the journal more useful because, you cite some journals sometimes, but you don't even think about the journal, like whether it's big or small. But the journal has been around for 25 years, and I said to myself, writing papers, I'm sure I probably have cited something from this journal, and I think it's important for students to use those peer-reviewed journals more often and really understand the information there because we live in a world where people like to spread misinformation, and so you have to know how for yourself.
And it's not just Google and stuff.
So we're trying to create some course packs so that we can reach even more students so we can, form that partnership. Because I'm always looking to form partnerships because it's funny, the editorial associate, she doesn't have a background in public health, but she always says, like, I don't know as much about public health as you guys do. I just read the articles and I edit them. Sometimes I feel like I can't help. But I told her, you are still contributing to public health just by reading those articles editing those articles and making sure they get out in the journal, you are a part of public health.
I think you made an interesting point, and that really captivated my attention. So my new role, as I've transitioned out of being the breakfast coordinator, and my new role is to serve as an editor for an information technology company. And with this role, I'm using those same skill set. So listening to the epidemiologists, listening to the statisticians, I hear a lot of jargon, right? And so my role as a health educator then was to translate that into common language the lay audience would understand, whether it be like a program manager or someone from the community. So what I did was took those transferable skills and I earned this role as an editor. So what I do now is I listen to business jargon, IT jargon, and I translate that information into simple terms. And so because I have a background in public health, I can understand from the client's perspective on what they need as far as breaking the information down to service their population. And so they deal with a lot of population health management here. And so I think those are really great skills. So if I could speak with her, I would definitely say, your skill set is to be on the outside looking in. And she's not familiar with the terminology, which is an asset because she can break things, she can ask you guys questions. You guys are the subject matter experts, and you can she can help you break that information down so that people who's reading the journal can actually understand what's being said. So that's a very valuable skill. So kudos to her. I love editors.
When trying to reach the community, I try to tell people this all the time, and I don't know if it may be the same, but I know when I was going through my courses, it was explained to me that the majority of the United States reads at a 5th grade reading level or below, so readability of materials is important, especially because some offices, and I don't want to talk down on them because it may be the only resource they have, but they tend to give out pamphlets expecting the patients to read them and understand them, but sometimes they are written with that jargon included, and they just kind of throw it to the side, and then the doctors wonder why the patients don't adhere to whatever advice they give them, but sometimes it's just because they don't understand.
Health literacy 101. You captured it.
Can you tell me a little bit? I know you've written a few papers here. Did you want to talk about some of your research?
Part of my work working in the service program, the CDC program at the state level, because I had access to the data and I understood how to use SAS to analyze the data, a lot of the researchers in the medical school wanted to publish the data, but they didn't have an analyst. And so part of my role all of my role on those papers that I've co-authored was just to serve as a resource and use my analytic skills, research skills to help them understand the data set. And so they would pick the topic and then they would come to me to the analysis and the documentation. And so that's how I have been able to co-author, I think it was visual impairment paper, then falls and diabetic retinopathy. And then we're working on one now on depression. And so I would encourage students, professionals, if you have some sort of analytic expertise, to work with some of those medical school faculty and help them to publish their papers, and then allow them to put you in as a co-author. Figure out what it is you really like doing, what you're really good at, and work on defining your niche a little bit better, whether it's analysis, programming, managing a program of your own, administration. A lot of people like paperwork and documentation as far as grants and stuff. So there's so many aspects of public health to be tapped into.
What are some resources that you might have there on your site or that you might have used
I recently developed a resource document. A lot of people want to sit for this base SAS certification, and so I compiled a list of, I think, 20 or so resources that are available online that you can just read about and kind of look at some of the sample questions that are going to be on the base SAS certification exam.
Thank you so much. I appreciate you being on the show.
I appreciate you for reaching out to me and even asking me to be a part of your project. I think it's excellent. And if there's anything that I can do to help you and support you, I'm here for you, okay?
Awesome. Thank you so much. Have a great day.